According to WHO, breast cancer is currently the most common type of cancer worldwide. In fact, breast cancer is a leading cause of death amongst women. The month of October is known as Breast Cancer Awareness Month, and so a lot of programs, a lot of platforms are used to create awareness on breast cancer. Now, this week's edition, our focus is on breast cancer, and we had a chat a while ago with Dr Emmanuel Oyenuche, a private medical practitioner who said a whole lot about breast cancer, people that are at risk. People have also asked questions like, is there a color of underwear that could cause breast cancer? Find out on this episode. Plus, Marcel Ruth Friends Cancer Support Group had a breast care day, and the emphasis was on early detection. I'm sure that's a report you would like to see. My name is Nkem Kibe, and you know I always love to do this with you every week. We'll go on a short break. When we return, we'll join the interview with Dr Emmanuel Oyenuche. Enjoy the program. On today's episode, our topic is on breast cancer, and my guest today is Dr. Emmanuel Oyenuche. My guest today has spent over 15 years in the medical field and has treated a lot of women that have come down with breast cancer. My guest today is also a private medical practitioner. You're welcome to the program.
Thank you.
Okay, talking about breast cancer, one of the things we should look at are what are the risk factors? What are those factors that, if associated with you might have breast cancer, you might have the tendency of coming down with breast cancer?
Yeah, breast cancer is kind of a mysterious, just like other cancers. However, we are more comfortable to talk about risk factors than causes. The risk factors, the common ones, of course, genetic. There are some genes that have been implicated in breast cancer. So some people that are predisposed. You will remember the story of a popular Hollywood actress that cut off her breast because she was exposed to. She realized that she had a gene that linked to breast cancer, so she had to chop off her breast to prevent coming down with cancer. So genetic is a strong factor, and also the other factors, lifestyle is also important. That's why you notice a lot of people coming down with breast cancer. So it has been said that much alcohol intake in women predisposes them to breast cancer. Diet, a lot of all these refined foods, and which leads to obesity, is also implicated in breast cancer. Some drugs also predispose people to, having breast cancer. Then exposure to radiations and all that, you make some people also to have breast cancer. It's also felt that people who have been exposed to estrogen, a hormone, maybe people who have their menopause, people who early saw their menses early. That means early menarche or something, what we call menarche, when menses come out early. And people who have late menopause, they also have chances of having breast cancer because they have long exposure to the hormone that is implicated as estrogen. So those are some of the risk factors. There are other ones. There is a recent study that has to do with breast implants. Women who use breast implants, has been found that two reasons. The breast implant affects, it may not allow for the thing to be diagnosed early. It's also thought that breast implant affects the tissue consistency because density of the breast can also be a factor, a risk factor. So it's also something that is ongoing research in that aspect now.
All right, can you talk about the danger signs? There should be some signs that if you notice them as a woman, you should see your doctor. Maybe those signs that you think that, okay, this could be cancer, I'm not sure, but I think I should see my doctor. Let's talk about the signs that women should look out for.
The commonest one is lump. When any woman notices a lump, every lump, it must be emphasized because when people see lump, they begin to panic. It must be emphasized that every lump is not breast cancer until proven. But it's important that once a woman notices a lump, that you see the doctor, see the medical practitioner, so you can take it off from there. So that's the first important thing, and every woman should be able to examine her breast. What you do regularly, when there is something wrong, you will know. So lump is one key thing. Also, changes in skin. If there are changes in the skin color, some people the skin appear red. Sometimes the skin just looks thickened or is peeling off. It's also a concern that you should check. Also, even the nipple. Sometimes the nipple will not just be the normal shape, pointed. It might be inverted. Or it might just be pointing in a different direction. It can also be things that you look out for. And pain. Some people just continue to have breast pain, and you notice that breast pain doesn't change with menses. There is that cyclical pain that happens, but this one is there every time, and it's also something that will make one know that let me be sure to see a doctor to know, is it something that is of concern or is nothing to worry about. So those are some of the things that also the size. Sometimes because if there is a growth, of course it will be bigger. Those are small things that can be noticed, so everyone should just be conscious of that. If you notice that change in size, pain, skin color change, sometimes that's what they call peel the orange. It looks like an orange peel. It's something that one should be concerned about.
There's this, I don't know if it's a widely accepted myth that if you wear a black underwear or you use the washing machine to wash your clothes, you could come down with cancer, or you're not advised to even wear black underwears for women. So how does this relate to causing cancer?
Yeah, some of those things are just myths and tales, what we call market women talk. There are a lot of things you hear. There is no scientific proof that wearing a black underwear is related to breast cancer. You may feel hot or warm because black absorbs heat, but there is no documented evidence, I know, that underwear is related to breast cancer. So for now, we just take it that it's myth. That people just speculate.
You mentioned something earlier about self-examination. Can you just describe to us, or can you just show us how a woman could just on her own do some kind of self-examination? Because some people have had these lumps over the years and they might not notice it on time. For some women that don't even touch their own body. So is there any kind of, can you just describe how you're supposed to do this self-examination yourself?
Yeah, without making it too technical. It's just good that the woman checks herself in a mirror, maybe before taking her bath. She just looks at, even looking at it alone every day will help you know when there are changes. For instance, you see your nipple, you know how your nipple is, the size, the way it is. So if the nipple deviates, begins to be inverted, you will know. If the size is getting bigger, too big, or even shrinking, as the case may be, you will also know. If the color, you see redness, and so before you even touch the breast, you will notice differences there. And of course, if you press the nipple, every woman, you should be able to press your nipple. If the nipple has a discharge, and in this case is bloody, that means mixed with blood, because some women have a condition where they have discharge. So it's not every discharge that should make you worry. You can have a discharge that is related with what we call galactoria. That means the woman is expressing a milk when it's not breastfeeding. It can happen in some women, but the discharge we are concerned is the one that has blood. Sometimes it's painful, So for the woman to examine, so when you observe that, to examine, so you can raise hand. You can, the woman can raise her two hands above her head and check and see the shape. Sometimes also you put hand by your side. So, but the important thing is to divide the breast into 4 parts, what we call quadrants. So we now have right upper, left upper, right lower, left lower, and just like a massage, press. Make sure that way all the sides are covered. So press from one side. You can take from clockwise or anti-clockwise manner. And then check thoroughly. If you do it regularly, you are likely to note. But if you don't do it at all, you don't know how dense the breast tissue is. So if you feel something dense, you will begin to panic. But if it is done regularly, you will know when you begin to feel so thorough. And since it's your breast, you will be relaxed with yourself, and you are the best person to examine yourself, not even the doctor, because you are the one that has the breast. So when you must press it, try to make sure that you make contact with the solid structure, that's the chest bone. And so when you do it thoroughly, go clockwise or anti-clockwise manner, make sure you cover the 4 parts of the breast, and then you will be able to. So that's just the simple thing you need to do. That way you will be able to pick up something early, and it's so important that every woman does that, because it can just be the what will save between early detection and late detection. Research has proven that breastfeeding has some effect on reducing the chances of having breast cancer. However, it's not 100% thing. It's and it may not work for everyone, So, but it has been found, maybe because of the link between estrogen, the hormone that is implicated, and breastfeeding. When a woman is breastfeeding, the exposure to estrogen is reduced. Okay. So that's the major thing that is pointing to that. So we can say it's documented that breastfeeding reduces the chances, the risk of one coming with breast cancer. It doesn't eliminate it. Because there are other factors that are interplaying. If the woman has a genetic predisposition or has had breast cancer before, even breastfeeding, it can reoccur. So one factor may not eliminate the other, but yes, breastfeeding does have some positive impact on women.
So you find a lot of young people coming down with they're having lumps in their breast and all, and most of them are not, in quotes, they're not in reproductive age. So what would you say is responsible for that?
Yeah, there are a number of factors that has been suspected. Before now, you can just close your eyes and say certain age it will not be. It will not be that if there's a lump in it has been grouped into age, it will not be. But you can't be very certain again. And just like a lot of things have changed, ranging from climate to diet to exposure to all these radiations, electronic things everywhere. So there are still researches going on why, but it is true that age bracket has widened now in regards to not just breast cancer, other malignancies. So we know a lot of factors: radiation exposure, diet, lifestyle, being westernized, and all that. So it's true, and it's a major cause for concern, because you see young people now coming down with breast cancer and other kinds of malignancies.
Okay, let's talk about the treatment options for breast cancer. Particularly, I'm sure that a lot of things should have improved in terms of research. So what are the treatment options? Because a lot of people get so scared when you mention breast cancer, or someone has had breast cancer before now. Must you even cut the breast?
The treatment options has not really changed. Okay. However, it's now the emphasis is now on early detection. Okay. If it's detected earlier, there is a higher chance of survival. Okay. So that's the attention. But the treatment option has always been grouped into 2 broad groups: the medical and the surgical. Okay. Yeah. So the medical involves all the therapy, and also it depends on the size of that cancer, the invasive nature. I mean, has it spread beyond where it originally started? Has it metastasized? Metastasis means has it moved, transported from the original spot to other parts of the body. That will determine the treatment that will be given. For instance, if it's still just at a particular place, they may just remove it. Okay. Yeah. So age also is a factor. They may
remove it. Remove what?
They may remove the lump, the cancer. Lump, if it is discovered itself early and it has not spread, it can be removed.
Not the breast.
No, not the breast. Yes, it can be removed. That means it's called local excision. Okay. Local excision is removed. Local wide excision. Okay. It can be removed there. So medical therapy covers even radiotherapy, where they use rays, and then chemotherapy, endocrine therapy, because those cancer cells are sensitive to some hormones. So so those are, but that is left for the doctors and also the specialists to handle. We are just enlightening the public on that. So the treatment modality has not changed. Once there is breast cancer, the specialist handles it. Can be medical therapy, can be surgical, can be combination of both, as the case may be. So some may involve removing the breast, the particular tissues. Some may involve what they call mastectomy. That means a wider removal of breast tissues and the environs, and the reconstruction. These days they do reconstruction also, so for cosmetic reasons.
Okay. So finally, doctor, in 1 minute, just tell us what are the preventive measures and what's your message to Nigerian women, particularly young women?
The preventive measures, if you look at the risk factors, you can get preventive measures from there. So we just try to make people to know, eat good food, balanced food, and do more vegetable, fruits, all those natural things that are healthy. Some of those so much synthetic things and canned food, they have chemicals. We should not be excited about everything that comes from abroad. So because if you get everything that comes from abroad, you also get abroad challenges and sicknesses. So lifestyle is important. That exercise that we do is important. Natural foods that we eat, they are important. So and then people watch not getting exposed. Also occupational hazard. So generally people should watch what they eat, do exercise, and in this part of the world, and generally we believe in God, so also pray is very vital. So for women out there, especially young women, there is no need to panic. Every lump is not breast cancer. Every lump in the breast is not breast cancer. Majority are not. So but how do you know? If you visit the doctor, let it be examined, and then you can be able to know. There are ways without even going to do anything invasive. You can just do a simple scan for women who are less than 35 years, and then mammography for the ones that are above, and something can start from there. So no need to panic, but understand what it is. Be able to examine yourself. If you have any reason to suspect, see the doctor, and it will be taken from there.
Thank you so much, Dr. Emmanuel Oyenuche. He has said a whole lot about breast cancer. The thing is, if you notice any kind of lump or any abnormal pain, please see your doctor. I know that we are very religious in this climb where we say, oh, it's not my portion, it's not my this, but don't forget that prevention is far, far better and cheaper than cure. And so you'd have noticed that a lot of emphasis was laid on early detection. Early detection is key to survival. Early detection is also key to your response to treatment. So if you notice any kind of lump at all, in fact, I think you should learn how to examine your breast by yourself. You notice any lump, please see the doctor. And you'd have also heard from the report that it could also affect men or women. So yes, breast cancer, basically women, but sometimes it affects men. So basically, if you notice any lump as a woman, as a man, please see your doctor. Don't forget to send us a mail on okibeinkem@gmail.com. Send a text to 07060865487. Remember, the health conscious people live longer. My name is Nkem Okibe. Join us next week, same time, same station. Bye.